My name is Ken Silverman. I'm a professor of psychiatry and behavioral science at the Johns Hopkins University School of Medicine. We're trying to see if we could use employment as a vehicle or as an incentive to promote abstinence and other therapeutic behavior change. So to do that, we made a model employment intervention that we've called the Therapeutic Workplace. We hire people with long histories of drug addiction as employees in the therapeutic workplace and pay them to work. But to promote abstinence, we require they provide drug-free urine samples to maintain maximum pay, and that way they could work and maintain their pay, but only as long as they stay abstinent from drugs. We focused our intervention on poor and chronically unemployed people, and so for those people, many of whom don't have job skills that they need, we have developed two phases of intervention. The first phase, their job is to participate in an intensive stipend-supported job skills training program. And once skilled, they can move on to employment and perform real jobs. And throughout both phases, they have to provide routine drug samples that are negative for whatever drugs we're trying to promote abstinence from. Heroin and cocaine are the typical ones that we do. We've done a number of randomized controlled trials that have shown therapeutic workplace can be effective both at initiating and maintaining abstinence over long periods of time. It's also effective in promoting adherence to the opioid antagonist naltrexone, including the extended release formulation called Vivitrol. I guess one of the most important things is that we've seen that we can, if we can maintain the therapeutic contingencies long term, we can maintain abstinence for long periods of time that could last sometimes years. Long-term recovery is possible, but I think to have that occur reliably needs special efforts. That's a lot of why we're trying to use the therapeutic workplace as a long-term intervention, because employment, if someone is a productive, successful employee, they can maintain their employment for long term, and if you require random drug testing throughout that kind of, then you could potentially maintain abstinence for long term and potentially indefinitely. Statistically, people who have employment generally do better. And that's generally true. It's not clear that employment itself is the factor that causes that. So what I'm saying is, if you take someone who has a drug problem, simply employing them in our studies does not reliably result in their remaining abstinent. Only when we apply special contingencies, where we do frequent drug testing and require that they maintain abstinence to maintain their maximum pay, that we see reliable effects on abstinence.